Please note this video was filmed during the COVID-19 pandemic. For the latest maternity service advice and information about COVID-19, please visit our dedicated site at www.mtw.nhs.uk/COVID-19 maternity information. Our videos so far have looked at the different stages of labour. So you have the first stage, which is from when your cervix is about 4 centimetres dilated and you're having regular contractions up until your cervix has completely gone and you're ready to push. The second stage is when you are pushing your baby out up until the birth of your baby. This video is going to be talking a bit about the third stage of labour, and that is the birth of your placenta, the membranes that surround your baby and the baby's cord. There are two main options for how you can birth your placenta. The first is what we call the physiological third stage, so completely unaided, your body births your placenta by itself. And the second option is an actively managed third stage, where we assist you with birthing your placenta. Whichever way that you decide, or whichever way is recommended and is best at the time, the same three principles will be applied. Firstly, we will allow the cord to pulsate for at least a minute after baby's born, and we'll talk a little bit about the benefits and why we do that a bit later on. The second principle is that we will try our best to minimise the amount of blood loss that happens. And the third principle is that we will try and minimise the amount of disruption between you and your baby in those first precious minutes after their birth. We'll start by talking about a physiological third stage of labour. So a physiological third stage is where we do not interfere at all in the birth of your placenta. Your body will naturally continue to have contractions after the birth of your baby, and they will help to push the placenta out in just the same way that you've pushed out your baby. You may start to feel pressure in your bottom, just like you did when you were pushing your baby as the placenta comes down into the vagina. So normally with a few pushes, your placenta will be out. Your midwife may recommend that you be more upright, you might stand or move around a little bit more. Sometimes if you're planning on breastfeeding, having baby on the breast can help stimulate some more contractions. Emptying your bladder and sitting on the toilet as well can just help give placenta that little bit of extra encouragement to be born. Generally, a physiological third stage is only possible if your birth has been straightforward, has started spontaneously, and you've birthed your baby vaginally. Generally, your placenta can take anywhere up to an hour to be born if you're using this method. If your midwife feels that the bleeding is getting heavier or you're not feeling very well, then they may recommend switching to an actively managed third stage. An actively managed third stage involves the midwife or doctor at your birth giving you an injection of a hormone called oxytocin. Oxytocin is the same hormone that you use naturally and produce naturally to labour. We give you a synthetic version just to help your uterus contract. The injection will be given quite soon after the birth. Whereas in a physiological third stage, you're required to do a little bit of pushing to deliver your placenta, no pushing is required with an actively managed third stage. After the injection has been given and has taken effect, the doctor or midwife will gently pull on the cord to help birth your placenta. An actively managed third stage generally is a lot shorter than a physiological third stage. Normally takes anywhere up to half an hour to deliver your placenta. As we mentioned at the beginning of this video, one of the key principles that we maintain whichever way you choose to deliver your placenta is that we offer every baby delayed cord clamping. Over the last decade, more and more research is emerging telling us about the benefits of leaving the cord to pulsate for at least that minute after the baby is born. This means the baby will receive extra blood flow, red blood cells, stem cells and iron, which will help reduce the risk of anemia in childhood. Once the cord has stopped pulsating, or once you're ready for the cord to be cut, then you or your birth partner or the midwife can cut the cord. It's completely up to you. Although delayed cord clamping is now much more commonly accepted as a standard, regardless of how you birth your baby, either by cesarean section or by vaginal birth, it's still worth putting it in your birth plan and letting your midwives and your doctors know that you're really keen to have delayed cord clamping. If you have any other specific preferences about your third stage of labour, such as if you're planning on keeping your placenta, then please let us know and we can accommodate those for you. If your third stage lasts for longer than an hour, then we would consider this a delay in the third stage. If you've had a home birth or you're at one of our birth centres, then we would arrange transferring you to our delivery suite here at Tunbridge Wells Hospital. Once here, we would ask one of our doctors to come and review you and make a plan. Sometimes there's a delay because the placenta just needs a bit further assistance to be born. In this case, we would recommend transferring you to our theatre on delivery suite, where we can give you further pain relief and the doctor can deliver your placenta safely. It is really important to explore all of your options for the safe birth of your placenta during your pregnancy, and do discuss any questions that you might have with your midwife.